and then move right into, based upon what we've talked about regarding the recovery and the pricing, what's your ideal time frame? And then we find out from them, like, are they like kicking rocks right now? Are they just kind of, investigating? Or are they really, I want to have this done by fall because I'm going on vacation? So then you learn these things about the patient. And then as you're moving to, okay, the next step would be to set up a consultation. During that 1 hour visit, this is what's going to happen. And then you kind of explain everything to them so they can visualize it. And then I think it's really, really important at that part where you just say, this is usually when I let patients know, in order to secure time on Doc's schedule, there is a 20% refundable deposit. It's refundable up to 30 days prior to the surgery. So if you need to make any changes or anything up to a month prior, you can. But that way, if I tell you now, you can come prepared, so that if you've already told me you have a very specific time frame, that way we can typically start looking at dates, because we're usually booked out a few months in advance at least. And so this way you'll get your preferred date. And what that does is, again, it creates a little bit of sense of urgency for the patient. It educates them about what they need to do to take the next steps. Because if you wait until they're sitting in front of you and you're giving them a quote to tell them about the deposit policy and when things are due, that just prolongs their process, and it prolongs how long it takes us to, from the first phone call and consult, to actually getting them on the schedule and helping them to reach their goals.